Mahama didn't build Ridge Hospital. He didn't build Kotokuraba Market. In your own studios, Star FM, Mr. Dufo, Dr. Dufo, was here. And he said as finance minister, he signed the contract for the loan for Kotokuraba Market, for Ridge Hospital, and a host of other projects. Mr. Mahama has no hand in Kotokuraba Market.
So who built Kotokuraba?
Give some credit to the man from Central Region.
Who is the Prof Mills?
At least we've had a man, a professor as such, from Central Region, who has become a president.
See.
Prof Mills was so magnanimous in that when he completed the N1 highway, he told Ghanaians, please, it is not my project. The Millennium Challenge account that's constructed that road, it's not my project. It's President Kufuor's project. So he invited President Kufuor to the commissioning of the road.
I never mentioned N1 here.
I'm giving an example. So if today, after Prof Mills passed, he held your hand against all odds to the disaffection of other members in your own party and made you a vice president, and after him, you took over as president, the least you can do for Prof Mills is to credit him with the things he did. Ridge Hospital, Kotokuraba Market, as my brother is saying, they are all Prof Mills' projects. Mr. Mahama has no hand anywhere. Are you telling us that Mr. Mahama built Tamale Teaching Hospital? When Tamale Teaching Hospital was training doctors, Mr. Mahama was still an MP or had not even gone to Parliament. Are you telling Ghanaians that he built Walgatanga Hospital? It is not true. So why do you sit on a platform to tell lies that doctors are also trying hard to receive salaries? It is never the case. If there is any government that has been so magnanimous to doctors, it's this government. The government has signed condition of service. Aside the yearly increment in public sector salaries, the doctors over the past 2 years have at least benefited from the condition of service that comes at the middle of the year, every year in this administration. Doctors are not struggling to receive salaries. The doctors in our recent history who struggled, the junior doctor, house officers, those who had completed school and started working afresh, they worked 11 good months under Mr. Mahama, the competent one, without receiving salaries. It is never the case in this administration. Even when I was a house officer, in a record 2.5 months in 2017, I received my salaries. 2015, under Mr. Mahama, doctors worked for 11 months. Today, doctors are receiving free education. Do you know you are receiving free education? You can walk from your studios to the College of Physicians and Surgeons. Every doctor receiving training to become a specialist in this country, the Kufuor NPP administration has made schooling free. They don't pay school fees. Hitherto, under administration, we were paying fees. The doctors who had car waiver motivation, President Kufuor introduced, Prof Mills continued. Mr. Mahama and the administration came to cancel them. So any doctor, any healthcare worker who is listening to us can judge between the two. The one that came and canceled the allowances. Government owes the nurses, but they, like the nurses to say, allowances delayed, better than allowances cancelled. You cancel them, and you are making a U-turn to come and say that when you come, you continue. Can we take you serious? If governance is about seriousness, then one that has occupied the position that you expect some form of seriousness from the person who claimed free SHS should not be implemented on the whimsical promise of a desperate politician, stood on a platform, lied to Ghanaians, and said he introduced free SHS. The person who has occupied the position, and we expect some seriousness from him, per the words of my brother, stood on a platform, met journalists, and told them it is the NDC that introduced NHIS from Nkranza and Damongo, but it's not true. It was the community leaders and the community people in conjunction with the Catholic Church that introduced those health insurance in those communities. It is never true. So if it's about lies, your candidate, who has been a vice president, who has been a president also, stood on a platform and in all seriousness looked in the faces of the people who sell his message and lied to them. Is governance about lies? So if Dr. Baumia has said one or two things that didn't come to pass, and your candidate, who has been a president before and is expected to know better, expected to see the presidency as a serious business. It's clearly. I have not admitted it. I said if. I said if. I used a conditional clause. Okay. I used a conditional clause. I said if. I used a conditional clause. So please listen to me. Okay. That indeed, if it's about seriousness and lies, the one who has occupied the position before, expected to know better, coming to lie to us, and you are here repeating the lies. Kotokuraba Market, there's not his project. Ridge Hospital, there's not his project. Doctors are struggling to receive salaries. Meanwhile, under your administration, junior doctors worked for 3 months without getting salaries, and 11 months without getting salaries.